I can lecture as a professor about being culturally sensitive to the stresses and strains of the vulnerable populations, but to actually be in the exam room and to really feel what the families are experiencing is invaluable.
My interest in working with especially underserved populations, because I feel like I came from an underserved population and an underserved community, and I looked for resources to help me and to guide me.
We try to locate women who are like low income, who don't have a lot of resources, and provide them volunteer doula services or doula services at a really reduced cost. So they're able to have those services as well.
I don't feel that you can call yourself a real nurse if you are not able to help those less unfortunate.
And there's going to be an explosion of opportunities for the students to work in rural and urban areas with the underserved population. So this experience just prepares them in a special way for the population. They'll have opportunities.
In the United States, period, African American women are affected more by high blood pressure. I am from Detroit. I went to school in Railroad, but I would like to take some of the work that I've done and see it be put into effect in the community that I came from, especially with it being such a huge issue there.
And this is a federally qualified health center. Chaz is a federally qualified health center. The students love coming here because nursing is a rewarding career. You really, not a day goes by where one of your patients always says thank you, or gracias here, and see where they're from, their appreciation for having health care provided in their neighborhood, knowing they don't have insurance, knowing that we care. It's just an additional dimension that you have to be here and feel it and appreciate it, and the students get it.
So I started here in my first semester of clinical rotations as a FNP student, and I saw a variety of patients, and it was really eye-opening because you got to see so many different cultures within the Latino population.
And it's a nice new building, but Mary specifically as a preceptor tries to get the students out even for lunch to see the neighborhoods, see the homes, see the housing, the urban poor setting of Southwest Detroit, and see where the families are living.
In nursing, you're always taught to provide culturally competent care, but this actually gives you the opportunity to experience it firsthand.
People lose their jobs, and families can be embarrassed to share their struggling financially and the resources. So I think the sensitivities don't make assumptions that there are families in need no matter where you're working.
We want to focus on the patient and involve them in their care, involve them in setting goals, and kind of seeing what's feasible for them.
At the end of the day, a car rolling off an assembly plant isn't going to say thank you and hold your hand. And it can be draining, you have to give a lot, but you get it back. So it all balances out in the end.